Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over some knee stretches. We're going to go over 3 knee stretches. The one thing that needs to be said before we start on the knee stretches is every muscle pretty much in the leg crosses that knee joint. So it's really hard just to stretch the knee. If you really feel tightness or stiffness in your knee, you want to make sure that you're stretching out your hip, you're stretching out your lower leg. So you're going to see a lot of the stretches that we're going to do tonight is going to incorporate kind of the whole leg in order to be able to stretch out all the muscles that are involved at the knee. Now, we're only going to go through 3, so this is not a super comprehensive stretching program, but this one will target a lot of the main structures in the front, on the inside, and then on the back of the knee if you're looking for some good stretches. If you get pain with any of this, obviously don't continue to do that. You don't want to push through the pain. You want to make sure that you consult a medical professional to figure out what's going on. The first one we're going to do is just a quad stretch. So the quad is just the group of muscles found on the front of your leg. So you're just going to stand on one leg. If you're not good with balance, you can hold on to something with this other arm. You're just going to pull this leg back, and then you're going to stretch. And I'm going to show you from the side. So you're going to pull back and stretch. Now, some of you may need to put your foot up on a chair because you can't reach your leg. That's okay. And then you can hop backwards so you can get that nice stretch in the front of the leg. If you're able to, this is going to be the most effective stretch for the front of your leg. You can do this laying down. If that's too much, you can also grab a strap and do it that way. A couple of variations on how to do that, but this is, again, I don't want any pain going down the front of your leg when you do this. The easiest way to do this is just to hold on to something, prop your leg up, and then kind of scoot backwards so you can get a little bit bigger stretch in the front of your leg. Second stretch we're going to go over is the inside of the knee stretch. So what you're going to do, spread your legs apart. Whichever leg you want to stretch, you want to make sure your toes are pointing forward on both legs. The leg you're trying to stretch is going to stay straight. You're just going to bend that other knee. What you don't want to do is you don't want to turn your hips. Otherwise, you're not going to get the stretch on the inside of the leg. So you just want to keep those hips nice and straight. Keep your toes pointing forward, bend, and you'll feel a stretch in that inner thigh area all the way down into the knee. Now, if you're really tight up in here, you're going to feel it more here as opposed to your knee. That's okay. It's hitting the same muscle that's coming down and crossing into your knee. And then same thing on the other side. If it's not, you don't feel it that way, you can always prop your leg up on a chair or on a step and then bend the knee on that side, keeping that leg straight, keeping those toes pointed forward so you feel that stretch on the inside. You want to do about 30-second hold, 6 of all of the stretches we're doing today. The more you can incorporate these in your everyday routine, the better it's going to be. It's really hard to get used to that stretching routine. I know in the beginning of the year, people really like to start off the new year with a stretching routine, but it's really hard to keep that going. So if you don't want to keep doing, these individual stretches, you might want to consider finding time throughout the day, whether, maybe washing dishes or something like that, where you will be able to utilize these stretches. The last stretch I'm going to show you is just a hamstring stretch. Easiest way to do this is sitting down, legs straight out, back straight, and you're going to hinge at the hips. It's not this. So you don't want to collapse at your back. You don't want to bend forward. You want to make sure you're nice and straight, and then you're hinging forward at the hip. So it's nice. You're going to feel it all the way down the back of your leg, into your knee, into the bottom of your foot, straight up and down, and just lean forward. If you feel any pain or any sort of numbness or tingling or any sort of sharp pain when you're doing that, you want to stop that immediately. You can also do this when standing up, propping your foot up on a chair. Again, nice and straight, hinging from the hips. We're not doing that. Stand up straight, nice and easy. Going to feel a stretch all the way into the back of the knee, probably down the leg and into the foot. Again, any pain, you want to stop that immediately, but that's going to get the back of the whole leg, back of the knee. Then you have the stretch is going to get the inside, stretch is going to get the front, and that will round out kind of all the muscles that'll hit the knee except the side, but that's more the IT band, and we have some foam rolling exercises, if you look at our Total Performance Physical Therapy YouTube channel, you can find some of those exercises for that IT band, which is more effective than stretching. If you or someone you know is suffering from knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.